This conference will now be recorded.
Okay. So good morning, everybody. Is my voice audible?
Yes, sir.
Okay. So today we will learn a new topic. We have learned about metallic poisons. Now today the topic is non-metallic poisons in irritants. So we know that poisons are broadly classified into four: corrosives, irritants, systemic poisons, and then miscellaneous poisons. Corrosives, irritants, systemic poisons, and miscellaneous poisons. In corrosives, we have three types: strong acids, strong alkalis, and metallic salts. In strong acids, we have two types: inorganic and organic. Examples in inorganic poisoning: sulfuric, nitric, hydrochloric acid. In organic poisons, we have carbolic acid, acetic acid, oxalic acid, and salicylic acid. Strong alkalis, we have three examples: sodium hydroxide, potassium hydroxide, and ammonium hydroxide. And metallic salts, we have so many chromates and bromates. And irritate poisons, they are broadly classified into again inorganic, organic, and mechanical poisons. Inorganic poisons, we have metallic poisons and then non-metallic poisons. In metallic poisons, we have seen all these five: arsenic, copper, lead, mercury, and then we have seen all these five, and also one more thing: copper, mercury, lead, and also iron poisoning. So we have seen five poisonings in this metallic poisons, and then today we will look into non-metallic poisons. We will look into phosphorus poisoning, and if time permits, we will also look into chlorine poison also. And then we have organic, which are different types of plants like datura, delirium plants, cardiac poison. These come in the plant words. And then animals, we have bite marks, such as snake bites, scorpion bites. So all these things will come in animal irritants. And then mechanical irritants, we have diamond dust and powder glass. So in non-metallic poisons, we have phosphorus as one example, and then chlorine, bromine, and iodine. Four examples are there in non-metallic inorganic irritants. Non-metallic inorganic irritants. So today we will look into phosphorus poisoning, and also, if time permits, a small topic like chlorine poison also there. So phosphorus poisoning, it is in two forms. One is red phosphorus, another is yellow phosphorus or white phosphorus. It is so red phosphorus, yellow phosphorus, or white phosphorus. Red phosphorus is non-poisonous. Yellow phosphorus and white phosphorus is poisonous. Yellow phosphorus or white phosphorus has a garlicky like odor, and then one feature is when it is exposed to air, it emits white fumes. When exposed to air, it emits white fumes, and then whenever a person who has taken this yellow or white phosphorus, when he is vomiting the food contents, or when he is defecating stools, both these things are luminous in dark because of the phosphorus content in their excreta or phosphorus content materials in their vomit. So they are luminous in dark and they are highly combustible and ignites into flame at 34 degrees centigrade. So a little bit of heat will going to cause ignition in case of phosphorus. That's why most of the uses of phosphorus, it is there in firecrackers. Firecrackers, the white color nature of the firecracker is nothing but phosphorus. So phosphorus, it is two types. One is red phosphorus, another is yellow or white phosphorus. Red phosphorus is non-poisonous. Yellow or white phosphorus is highly poisonous. It has the eye garlic odor and it emits white fumes. When exposed to air, it glows in the dark and it is highly combustible and ignites into flame at 34 degrees Celsius, at least as if it is a room temperature. So that's why it is kept always in a water. So yellow phosphorus or white phosphorus should be kept under water. Otherwise, when it is exposed to air, it becomes a combustible item. What are the uses of this phosphorus? Phosphorus is used in fertilizers, in chemical industries, in the manufacturing of fertilizers. It is also used as an insecticides or rodenticides. It is used in the manufacture of fireworks, and then it is used in the military uses. Yellow phosphorus is used in tracer bullets or incendiary bombs. Tracer bullets, we know that whenever a soldier fires, it will leave a tail at the back and then it will glow. The bullet or the cartridge will glow at the tail end of the bullet, and then the soldier can know at what point the target has hit, and then he can change the next target, whether by looking at this tracer, by looking at this white glow that is going on the back of this bullet or cartridge, whatever. So it is called tracer bullet. We can trace the pathway of the bullet with the use of this yellow phosphorus. And then incendiary bombs are also where they will attack the person, or they will be lodged inside the target, and then it will cause fire or it will explode at the target organ. They are called incendiary bombs, or there are incendiary bullets also, we can call them. So yellow phosphorus, one is tracer bullet. It will leave a pathway while it is going and hitting the target. Another is it will hit the target, and then at the point of target it will ignite itself, leaving the target organ in a very it will wound the target organ, target person, and sometimes it can also explode at the point of target. And then smoke screens, air sea rescue flares, all these things are used in the military purpose. The yellow phosphorus used. Safety matchstick, safety matchstick, what we normally used in kitchens, on the side of the thing and also on the knobs. It is nothing but red phosphorus. Red phosphorus is used on the side of the matchbox. Earlier it is yellow phosphorus was used, but because of the effects of if the little bit heat, it gets burned. So red phosphorus is used in safety matches now. So uses, it is used in fertilizers, insecticides, rodenticides, firearms, fireworks, military uses, and then safety matchbox. What is the mode of action of this yellow phosphorus? Yellow phosphorus or white phosphorus is a protoplasmic poison. It is a liver toxic, very, very important. Phosphorus is liver toxic. It is hepatotoxin. Hepatic toxic or liver toxic. It will kill the hepatic cells, thereby all the mechanism of synthesis whatever is taking place in the liver will be inhibited. Most of the time, the liver is the storehouse, and also it has a lot of instances of proteins and also coagulation uh, proteins. We have complement pathways. So all these products are synthesized in the liver, and whenever a phosphorus poisoning occurs, it will affect the liver. It is liver toxic, it is hepatic toxic. Thereby, all these protein synthesis will be inhibited and leading to further effects of these byproducts. So, in large doses, it has a direct effect on heart and cardiovascular system. Locally, it is called severe irritation of the skin and mucosa, like burns, and rate of absorption from the stomach is enhanced by taking oily media. So if you take fat rich diet, then the yellow phosphorus poisoning absorption will be more. It is a local irritant on the skin and mucosa, and then large doses will affect the heart and cardiovascular system. And the main thing is it is liver toxic or hepatotoxic. So poisoning, it includes acute poisoning and then chronic poisoning. Acute poisoning, we have three stages. Acute poisoning has three stages: stage 1, stage 2, and stage 3. Stage 1, it starts immediately after ingestion, where from the mouth to the stomach to the intestine, as the yellow phosphorus or white phosphorus is taken, it will cause a different symptomatology. In mouth, it causes burning pain, throat and intense thirst can be seen by the patient. Vomiting or vomitus is dark in color and garlicky like smell, and it is luminous. It will glow in the dark whenever the person is vomiting. And then diarrhea, it causes diarrhea. So it causes burning pain in the mouth, it causes burning pain in the throat, it causes intense thirst, it can cause vomiting, and the vomiting is luminous in dark, or it has garlic like odor. So we have in metallic poisoning, arsenic has also the garlic like odor, most important. And in non inorganic, we have phosphorus. Then intestines, there is diarrhea. This is all about stage 1. And stage 2, where the symptoms subside. So it is a period of well-being and it remains for 1 to 2 days, stage 2. And this stage, all the symptoms will stop, all the symptoms will cease, and the patient is little bit okay. He feels that he is okay, he is not having any symptoms, and his poisoning may not be occurring. So all these things happen. Stage 2 is a period where he is healthy and all the symptoms are not presenting in them. It takes about 1 to 2 days in this. And next comes stage 3, where the elemental phosphorus deposited from the blood in tissues oxidized to liberate hypophosphate. Very, very important. So this hypophosphate is what is toxic to liver mainly, and then to the kidneys. So the phosphorus poisoning will release hypophosphate from the tissues, and this hypophosphate is toxic to the liver and the kidney. So in the liver, it will cause jaundice, failure, liver failure, restlessness, delirium, and then coma. In kidney, hypophosphate will cause oliguria, and then further it leads to anuria. So these are some of the symptomatologies. Stage 1, most of the GI symptoms: burning, and then intense thirst. We have vomiting, which is luminous in the dark, and then we have diarrhea. Stage 2, there is complete well-being, and there is stoppage of symptoms, which occurs about 1 to 2 days. And then stage 3, there is a release of hypophosphate, from the phosphorus, and then this hypophosphate is poisonous to the liver and kidney, and the liver causes jaundice, failure, and then restlessness, delirium, and coma, and the kidney effects are it causes oliguria and pneumonia. These are all the symptoms of acute phosphorus poisoning. We have three stages: stage 1, stage 2, stage 3, and now fulminant poisoning. Fulminant poisoning is where if you take more doses, excessive amount of doses, then the patient will die immediately. There is nothing but fulminant poisoning. So when greater than 1 gram yellow phosphorus is taken, then the fulminant poisoning will occur. Death occurs within 12 hours, and the reason is due to shock and peripheral vascular collapse. And then here the hepatic and renal symptoms are absent. Only the hepatic and renal symptoms occur only in acute poisoning. In acute poisoning, acute phosphorus poisoning, the organ damage, liver and kidney damage is there. Whereas in case of fulminant poisoning, it directly affects the cardiovascular system, and then he will collapse within 12 hours. And fulminant poisoning is very rare nowadays. How do you manage a case of acute phosphorus poisoning? So routine stomach wash or gastric lavage by 5% potassium permanganate, which oxidizes phosphorus into less toxic phosphoric acid or phosphates. So stomach wash with potassium permanganate, 5% or 0.5% potassium permanganate, which converts this phosphorus into phosphoric acid and phosphates, which are less toxic. And then large intestine can also be thoroughly washed with magnesium sulfate. And then we can give high carbohydrate diet to protect the liver, IV fluids in order to compensate for shock, and then we can give injection vitamin K to combat hypoprothrombinemia. You know, all the thrombins they are synthesized in the liver. So prothrombinemia, and then all the clotting mechanisms, complement system mechanisms, they're all the products are synthesized in the liver. So whenever the liver is affected, then all hypoprothrombinemia can be resulting in the liver damage, and then the patient can have excessive bleeding tendencies. So that's why we give injection vitamin K injections in order to combat this hypoprothrombinemia. And then fatty foods should be avoided, because we know that oily media will increase the absorption of phosphorus from the stomach. So that's why we will tell the patient to avoid non-vegetarian food. And then dermal burns, treatment with warm water. Dermal burns are nothing but the phosphorus. I tell you, it is like irritant on the skin and mucosa, and the irritation is as if it is like a burns. So we will treat as if it is a burn case, and then treatment with warm water or 1% copper sulfate solution is applied over the irritant area. So this is the brief management of yellow phosphorus or white phosphorus poisoning. We give stomach wash with 0.5% potassium permanganate, large intestine wash with magnesium sulfate, carbohydrate diet to protect the liver, IV fluids to protect from shock, injection vitamin K in order to prevent hypoprothrombinemia caused due to liver damage, avoiding fatty food, and then applying 1% copper sulfate solution over the irritant area on the skin or mucosa. What are the PM findings? They are divided into two types: external examination or internal examination. External examination, the body looks emaciated, erosions of mucous membranes of the mouth and the mucosa of the mouth can be seen, breath smell, garlic-like smell. You know, breath smell, it is not that the patient is breathing, it is you that is breathing. So the examiner has to breathe near the mouth or near the poisoning, where the poison is there. So breath smell is what the examiner has to, not that patient, already the patient is dead. So breath smell by the examiner will have the garlicky like smell. Gums are swollen with the presence of bleeding points. So all these things can be seen in phosphorus poisoning. And then internal findings: stomach mucosa is swollen and soft. You can have erosions and desquamation of mucosa. Petechial hemorrhagic spots can be there. And then the contents of the stomach are dark brown. And then dark brownish is due to bleeding points. So normally yellow phosphorus or white phosphorus is yellowish or whitish in color. How does it become dark brownish? Is because of the bleeding points from the stomach, because of the erosions on the stomach wall. There can occur bleeding, and then this bleeding reddish brownish can change as the time goes on. So because of that, the vomitus is dark brownish in color. It is luminous, it glows in dark, and then it has a garlicky like smell. Liver shows enlargement, swollen, soft and greasy. There is fatty degeneration of the liver. And then if you take a slide and then examine under the microscope by the pathologist, we can have this centrilobular fibrosis. Centrilobular fibrosis can be seen as a pathological slide, apart from the gross, swollen, soft, greasy, fatty degeneration liver. And then the kidney, we can see tubular degeneration and hemorrhages on the surface and within the substance of the kidney can be there. So mainly congestive features are more in internal findings. There is swelling, there is softness, there is desquamation, there is, so congestive features are more in case of internal findings. Now chronic phosphorus poisoning. Chronic phosphorus poisoning is due to inhalation of phosphorus vapors in industries or in factories. So it is due to vapor inhalation of the phosphorus in factories that leads to chronic phosphorus poisoning. So consumption of seafood containing high quantities of phosphorus is also one of the reasons for chronic phosphorus poisoning. So two methods of chronic phosphorus poisoning: one is inhalation of vapors of phosphorus. Number two, seafood items consumption which contain the phosphorus. Symptomatology is same, almost same when compared to the acute phosphorus poisoning. We have GI disturbances, we have cirrhosis of the liver, muscular weaknesses, and one more important, very important is phossy jaw. Phossy jaw has been asked many times in the examination. It is a 2 marks question, sometimes can be asked as a 4 marks, but most of the time previously it has been asked as a 2 marks question. Phossy jaw. Phossy jaw is seen in chronic phosphorus poisoning. Phossy jaw, you can remember P for P. Phossy jaw is seen in chronic phosphorus poisoning. It is due to osteomyelitis of the jaw, osteomyelitis of the jawbone. So phossy jaw etiology, it is due to chronic phosphorus poisoning. It occurs in 3% of the industrial workers who are exposed to vapors of phosphorus for a longer time. So underline the word vapors. It is not due to ingestion of the phosphorus, but is due to vapors of phosphorus that is causing some necrosis of the jawbone. So there is some predisposing factors for this phossy jaw. One is caries teeth and then bad oral hygiene. Whenever there is a caries teeth and bad oral hygiene, and whenever a person is exposed to the vapors of phosphorus for a long time, then the phosphorus vapors can enter the skin through the oral cavity, and then it can affect the bone, jawbone, causing osteomyelitis and necrosis of the jawbone, leading to a condition known as phossy jaw. So what is the mode of action of these vapors, or whatever the mechanism of this occurrence of this phossy jaw is? It usually affects the lower jaw through caries or decayed tooth. So caries teeth or decayed tooth is the entrance through which the vapors of phosphorus will enter and affect the lower jaw. This leads to osteomyelitis and periosteosis of the jaw associated with the necrosis of alveolar part of the jawbone. Very important. So alveolar part of the jawbone is affected. Mostly the lower jaw is affected, and it is due to necrosis, which is due to osteomyelitis, and periosteosis, which is due to the caries tooth and decayed tooth, through which the vapors of the phosphorus will enter the system or enter the bone. So you can see this is the jawbone. You can see this is the teeth. You can see here in the lower jaw mandible, you can see there is necrosis. So whenever there is a bad teeth, whenever there is a bad oral hygiene, caries teeth, the vapors can easily enter through the defect into the jawbone, and then these vapors has a necrotic osteomyelitic, and it will cause periosteosis of the jawbone, leading to phossy jaw. And then externally the person can have a fistula. Here you can see the picture. You can have a fistula draining foul smelling pus from the bone. So multiple fistulas can be seen on the jawbone and on the neck region, which causes the bone spicules to come out. This is the condition which is known as phossy jaw. Phossy jaw caused due to vapors of phosphorus, leading to periosteosis and osteomyelitis. And then these are the symptoms. There is history of toothache, which is followed by swelling of the jaw. There is loosening of the teeth. There is slowing of gums. There is necrosis and sequestration of the bone of the mandible, with multiple sinuses discharging foul smelling pus. So there are multiple sinuses discharging foul smelling pus, and the sinuses can land on the jaw and the neck, upper part of the neck. And then the management is remove the patient from the site of exposure and then give proper oral hygiene. And then if the normally it will be get relieved by itself. If it is not relieving, then you have to take into the bone part, where some minor surgeries or scrapings can be done. But most of the time, if you remove the exposure, then the sequestration will stop, periosteosis will stop, and then osteomyelitis will stop. So, and then maintaining proper oral hygiene and dental hygiene is very important. So what is the medical legal importance? So medical legal importance of phosphorus poisoning: it is not a preferred suicidal or a homicidal poisoning. Definitely it is not a homicidal poisoning. Suicidal poisoning can occur because phosphorus is used in the rat poisoning. It is also used in insecticide, so the people can take it. Accidental poisoning occurs due to consumption of rat poisoning. Accidental poisoning, mostly this is not accidental. Mostly it can be a suicidal also. So sometimes accidental poison can occur by the children, where the rat poisoning balls will be there. Because of the color and yellowish nature, the children can eat that balls. So it is accidental poisoning in children, whereas suicidal poisoning in case of adults. It is used for creating smoke screens, particularly in field, which can cause poisoning. So mostly it is it causes smoke. I told you, whenever it reacts with the phosphorus, whenever it reacts with the air, it will emit smoke. And this smoke, whenever a person or a farmer inhales, he can have a poisoning. And then for criminal purposes, called arson. Arson is nothing but It is a deliberate act of setting fire to a house. Deliberate act of setting fire to a house. It is prepared by moist cow dung with yellow phosphorus mixed together and are thrown over the thatched cottage roof. When it becomes dry, the roof catches fire. So it is called arson, where if a person or in a community, if the people don't like, when one community or other community are fighting, so what they will do is they will take the cow dung, they will mix the cow dung with yellow phosphorus and throw this cow dung on the hatch houses of the thatched houses. And the next day morning, normally they will throw it at night times, and the next day morning when the sun comes, when the cow dung dries up, it will break away, and then the yellow phosphorus will be exposed to heat, and then this heat will catches fire, and then it will catch fire to the house. So it is for used as a criminal purpose also. Arson, that is known as arson. So medical legal importance, it is used as an arson. It is an accidental poison. It is a suicidal poisoning, and then it is used as a smoke screen in fields, which also can cause a poisoning symptoms. So this is about phosphorus. So we have little bit of chlorine poisoning also. So we will finish this 3 or 4 slides and we will close. So chlorine poisoning. Chlorine is a yellowish greenish yellow gas with a pungent odor. It combines with hydrogen to form acids and with metals to form salts. So it is, what are the uses of chlorine? Chlorine is used in bleaching agents, for bleaching cotton and paper. Chlorine is used for water purification with chlorine disinfectants. We know that all the wells and the municipal tap water is all chlorinated water, and then we can have a typical pungent smell in that. We know that sewage treatment is also chlorine is used, and then chlorine is used also in pharmaceuticals and cosmetic industries. What is the mechanism of action? Chlorine is an oxidizing agent. It is extremely active and oxidizing agent and causes rapid and extensive destruction of tissues. Fatal dose is 50 to 100 parts per million ppm. Parts per million, 50 to 100 parts per million ppm when inhaled can cause rapid fatality. Clinical features of chlorine poisoning. Chlorine is irritant gas, and inhalation causes rhinorrhea, lacrimation, coughing, chest pain, and then shortness of breath. Massive exposure can lead to laryngeal edema, stridor, pneumonitis, and pulmonary edema. And other features are vomiting, vertigo, reeling sensation, headache, ventricular ectopic beats, VEBs, and then metabolic acidosis. These are other non-specific symptoms. On chronic exposure, corrosion of teeth may also can occur. So mostly respiratory symptoms prevail in poisoning, where there is rhinorrhea, lacrimation, coughing, chest pain, and shortness of breath. Diagnosis is by characteristic odor. We have pungent odor, and chlorine gas leak into the atmosphere can be detected by opening a bottle of concentrated ammonium hydroxide, which will cause the production of heavy white fumes of ammonium chloride. So this is how we will diagnose chlorine gas poisoning. So we will open a bottle containing ammonium hydroxide bottle, and if heavy white fumes come from the bottle, then it indicates that the ammonium hydroxide has reacted with the chlorine of the air, leading to formation of ammonium chloride, which has a white fumes like structure. So one is two methods: by odor will diagnose the chlorine gas poisoning, and also by ammonium hydroxide bottle we can diagnose chlorine poisoning. Treatment: Mild poisoning can be managed with bed rest and oxygen administration. You can give nebulization with sodium bicarbonate, and it is effective in controlling respiratory symptoms. In severe cases, ventilation is necessary. Intermittent positive pressure ventilation is necessary. And then if the person is exposed to ice, then irrigation with water or with saline is what is required. So not much specific there, only bed rest, oxygenation, and then nebulization with sodium bicarbonate solution to control respiratory symptoms, and then intermittent positive pressure ventilation is given in severe cases. And if it is exposed to ice or sensitive or mouth, we can have to have clean with water and saline. Autopsy findings, they are nothing but characteristic of odor is there, pungent odor, and then the lungs will have a massive pulmonary edema changes. There can be congestion of the lungs leading to massive pulmonary edema. And forensic significance, chlorine gas leakage is mostly accidental, arising out of the domestic or industrial exposure, and it is also due to frequent exposure to swimming pools. Normally the swimming pool water is chlorinated often in order to prevent diseases from one person to other, in order to disinfect the water in swimming pools. A person who is exposed to swimming pool water frequently, then he can have this poisoning symptoms can be there. So this is about chlorine briefly. Most of the times chlorine is not asked in the examinations. Phosphorus has been asked. Phosphi-jaw has been asked. So this is about the phosphorus and the chlorine. So thank you very much for your patient listening. We will continue in the next class with the other topic. Thank you very much.